welcome back to the Untold, another episode, another amazing guest, Ahmed.
Yes.
Today we're gonna get into
Beauty.
quit smoking,
quitting
two different
smoking,
topics,
two
but
different topics, but somehow one doctor treats it all. This
Family
is a
doctor?
family doctor. She has an immense knowledge in helping people quit smoking. I want to see what the process is like, why she even wants to help people quit smoking as a family consultant. There's a lot to cover, so
let's get to know her
let's get to know her.
right after the break. So we're back again with our guest, Dr. Anwar Alnajjar. Dr. Anwar, let's start by introducing yourself to us and to the audience.
I'm Dr. Anwar Alnajjar. I'm a consultant family medicine, graduated from Kuwait University, and I continued my learning from the British Royal College, as a family doctor. Then I started to have a diploma in diabetes in addition to my family medicine practice. Then I started to study diploma in quit smoking treatment. So I become a specialist in quit smoking.
I didn't know the specialist exists in that
And
area.
quit
there is,
smoking
yeah.
is-
And then I
yeah.
started to study the aesthetic medicine,
Medicine.
as for beauty
So these are
and
two very different things you did.
yeah,
you know?
exactly.
I want to talk about the quit smoking thing because it's a very major thing. Vaping.
Yeah.
We're seeing kids, 13, 14. I know it's illegal, but we're seeing them everywhere.
It's illegal, but the problem is that we don't have a clear legislation for vape. You know, for cigarettes, it's clearly forbidden. No one can buy for children.
Right.
But for vape, they can order it from the Instagram. So it's really, it's. I have some patients.
I missed that point.
Yeah. I have some of my
True,
patients. They are adolescents, 13, 14. They started in the age of 13.
Or they can have someone who they know buying them.
Yeah, she's a female and she ordered it from the Instagram. She started like this. So there is actually no actual rules to rule the vape, and it's really a problem.
So
I know you got excited about smoking,
Yeah,
but
I
I want to
mean-
focus on the doctor. I want to start where I always start, the beginning.
after high school,
After high school, I would love for someone
Ahmed
like, I
wants
never
to
went to
know.
high school, you know? Never went to-
Ahmed wants to know everything that happens after high school. So
Why
let's
did
start
you
with that.
choose the medical field? Was it family pressure? Or was it something you always wanted to do? And how you got into the field that you are?
Why do you always assume that medical field, engineer field was a family pressure?
How many people did we have here that said that? How many
But
people?
to make that assumption though. But anyway.
You will start from the high school, as you said, but
Yeah.
actually I started it not from the high school
Oh.
to decide to be a doctor. It happens when I was like 8 or 9 years old.
So you had the dream of being a doctor.
Why?
Good,
Ask me why.
Why?
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 I was admitted to the hospital for a month. I was very sick at this age.
Oh.
Okay.
What was the, if you don't mind revealing?
Yeah,
the
it
issue?
was like an something infection. I don't know exactly
But
because
a
my
whole month
mother
in the hospital.
like for a whole month in the hospital, and
As a
I've
child,
seen
too.
as a child.
So you wanted to take revenge.
No.
No.
You wanted to give back.
This experience, it was very traumatic. I have some nurses, they were so hard on me. But at that time, I decided that I want to protect the children from having this, from what I had. So I decided that, no, I want to be a doctor. I want to protect them from some of the nurses who were bad. And actually, maybe I have this talent or gift from Allah that I change every negative,
positive.
something
You're
which is
optimistic.
negative,
You're optimistic.
to something which is positive. So it started like
So
from
Basically, you had two options: be a hero or a villain. Like you wanted revenge. She wants to be a hero.
No, I mean, like, I would assume if I got sick and I wanted to be a doctor because I want to take revenge.
Because I want to abuse the nurses. Under
No,
me, right?
I want to abuse the
Protect the
disease
children. This is
I want to
what I-
abuse the disease that hurt me.
Okay.
So at that
You
time,
had a noble cause.
yeah,
You had a noble cause.
at that time I decided no, I want to protect the children. I want to be like the one to protect not only the children, everyone in the world.
Nice.
The hero.
Right.
So then I start, growing up. All my toys are for doctors. Everything I plays with
Barbie,
the doctors.
who's a doctor.
Yeah, with the doctor. I take the toys for stethoscope. I go for
Nice,
my
nice.
mother and just examine
Okay.
them.
You've
Then
lived it.
Yeah, I lived it.
Yeah.
Yes, I saw myself as a doctor. Okay, so I start studying to have high marks and all this, to be graduated with a high percentage, to go to the medical school. But unfortunately, at that time, I had high percentage, but they didn't accept me from the first time.
What was your percentage?
It was 94% at my time
Oh,
from the
yeah.
high school, which is not the.
Yeah, it wasn't.
Medical seats are very limited.
Yeah, but
and
at
it's
my
always really
time, the
high.
highest it was 96%,
Yeah,
and
yeah.
for me it was 94.
Okay.
So I was not accepted. So I decided, no, this is my future. I want to take it. So I
Determination.
went to the Faculty of Science. I stayed there like for 2 years, and then I transferred to
Transferred to
medical
medical
school,
school.
and then I
That was a way to do it. That
continue
was a good way to do it.
my journey,
Yeah.
because it is my dream. I will not let it go. I have to take it. So when I finished the high school, I mean the medical college,
Yes.
we after that we go into different specialties.
Yeah.
So at that time, the first thing I decided that I want to be a surgeon.
Because you did rotations and
Yeah,
you
and
saw it.
many of the doctors, they told me that you have good hands in surgery.
Oh,
So I
okay.
thought maybe I would like to be
Yeah.
a surgeon, and especially I want to be an ophthalmologist.
Well,
Can
what is
you
that?
imagine?
I don't even.
Which is the eye surgery.
Eyes, yes.
Okay.
Doctor.
Yeah.
So the surgery of the eye. This is what's because
the scariest thing
yeah.
ever.
I don't
You
know.
know?
My LASIK surgery went well.
yeah.
I mean, I think
in anatomy, when we are in the medical school, I like the specific things. I like the small things in
you like the details.
Attention.
Yeah,
to detail,
yeah.
the
The
small
details, the
things.
small
Okay.
things. In the cadavers, when we do the dissections, I used to take the very tiny things in dissection. So I decided to be an ophthalmologist. But in the rotation, when we started to be like doctors, so everyone in the family asking you questions. What about this? What about that? So what is the specialty that I would go for everything? It's family medicine.
Family medicine.
So
Family
at that
medicine,
time, I
okay.
decided, no, I want to be a family medicine doctor, so I can help my mother, my father, and all the family. When they ask me a question, I can answer.
That's good. That's good. And as a your family medicine, how did you pivot to getting your degree or your diploma in quit smoking treatment?
Yeah.
And what inspired you to help smokers?
As family doctors, usually we treat patients with chronic diseases like diabetes, hypertension, bronchial asthma. And when I have the patient with bronchial asthma, especially the bronchial asthma, I've seen them, they are smokers. So how come I can treat the bronchial asthma and give them the medication with an exacerbation can occur with a trigger, a very important trigger, which is smoking. So, and that's bronchial asthma, we have very high incidence in Kuwait. Many patients, they have it from childhood till they grow up. And at the same time, I've seen many children at that time, they were smoking. I've seen a child who was 7-year-old
Smoking cigarettes?
smoking cigarettes.
What?
It must be his
Yeah.
dad.
No.
Does he even know what cigarettes are?
Can you imagine when I go out of the clinic, the primary care clinics, they used to be near to the schools and to the markets.
But
and-
still,
yeah. So
I was
when
near
go
school
out,
and
I
markets
see
the
them
entire
like they
time
are
and-
smoking.
What?
Yeah, kids
Yeah,
smoking.
yeah.
I didn't think kids in
smoking at
elementary school
7-year-old.
start smoking.
So at that time, I felt, when I told you in the beginning that I want to protect children.
Do
Yeah,
they
you wanna
even
protect
know
that child.
how to lit a cigarette? Are they even allowed
How
to
do you
use
not
lighters?
choke as a 7-year-old?
So at that time, I said, no way. I have
No
to
way. Gotta
to
help
take
this.
this specialty, because in the medical school they don't teach us details about how to treat smoking. Many doctors, like in medicine, in neuro, in every category, they don't know how to treat it like a whole person treatment.
So, can you share some of your success stories where you actually assisted or helped people quit smoking?
A story that stands out to you.
each one they had a story. So
But do
I
people
cannot,
actually quit? That's what
yeah,
I'm
yeah,
asking.
yeah.
the
Like,
patient when they come to me,
permanently.
initially when they come to me, and I can see from their eyes that they are willing. Like yesterday, I had one patient. He was from his eyes, I can notice that
He wants to
he wants
change.
to change,
He wants to
and they
change.
are, you know, like they are crying from inside.
But can they
want
do
the
it
help.
permanently? That's the question.
Yes,
What is
many.
the process of helping someone quit smoking?
It starts first with of course, the consultation and knowing the motive why he want to quit smoking, and to continue on this motivation and to start them on medication.
There are
So,
medications
Medication?
Yes, there is
that help, yeah.
medication.
Are we talking about those patches they use nowadays?
It's not the only thing. We have the
Okay.
patches, we have medication which is tablet, we have
Is it to give
short-term
him that
medication.
nicotine
Some
withdrawal
of,
to
yeah,
treat the withdrawal of nicotine?
yeah, some of the medication they have this idea is to treat the withdrawal symptoms,
Yeah.
so they replace the nicotine, but without taking other
Without-
harmful
right,
things.
right.
But also we have tablets which can give them. Not the nicotine, other things like the serotonin, which is so
Yeah.
it works like higher up in the
Yeah,
brain.
yeah.
So it's really successful process when they combine both the medical treatment with the psychological or the motivation treatment.
But how long does it take to actually quit?
It
guess
depends.
case by case.
Case by case. It depends. But
Well,
when they quit smoking,
how about
really,
the longest case and the shortest case you've had?
the shortest is like 4 months.
Okay.
Yeah,
You can
Okay.
quit smoking for months. That's
yeah.
good.
4 months. I mean, from the second week, you will stop taking any
yeah, yeah.
cigarette. But to
So-
be permanently,
To be okay.
decide
No,
that you
yeah,
are
you're
okay,
okay.
it's 4 months.
The
We
longest
can
case-
withdraw all medication at that
Right.
I
time.
have a question here. So a lot of people do start smoking, but how long does it take before you actually get addicted to smoking?
Yeah, you cannot imagine that it can happen in 2 weeks.
In 2 weeks?
Yes, to a month. Even if they don't smoke continuously, like every day, they can be addicted. It's not the amount, it's not the duration. It depends on person to person, but really high percentage of addiction can occur in 2 weeks, which is really very hard for like children especially. You know that the children they are growing and their brain cells can die and will be destroyed with the cigarettes.
Absolutely.
And
horrible.
this
And the impact on the lungs.
yeah, let's say the lungs and everything, but you know how the brain is
Developing.
and the nicotine is replacing all the transmitters in the brain, so this growth will be affected, their concentration, their intellectual development will be affected.
There's a reason why it's 21 and above, 18 and above, depending on the
It's
country.
just
There's a
because
reason
of
for that.
it's just to be an adult, but
Yeah.
actually I think it has to be like there's a better rule, you know, to increase the prices, to do something.
And they have done that. In Europe, in
Yeah.
the States, it's expensive.
Yeah, it's really
ridiculously expensive.
Yes, yes.
In Kuwait, it didn't become super expensive, but back in the day, it was what, 250 fils?
I think it
But
was.
now
You
it's
know?
1 kg
One
and a
kg,
half.
that is still a big
It's still-
difference.
But again,
Oh,
the
who's-
kids'
who's-
pocket money is a lot more.
Yeah, this is what I was
So
going to
the
say.
question is, what are the side effects of the withdrawal of nicotine in your
They
body?
can feel some withdrawal symptoms like headache. Some of them will be irritable, depression.
Depression?
Yes.
Is there?
And do you know that smoking itself can cause depression? And
Wow.
when
I've heard
They
some
think
people-
they're using smoking to relieve that depression.
No, because it will replace the neurotransmitters in the brain, so they will feel
Even more
more
depressed.
depressed. So they will need more nicotine to
I've
feel happy.
seen some
So
people
they
do
are-
it
It's a
for weight
cycle.
loss.
It's a vicious
Yeah,
cycle.
it's a cycle.
I've seen some people doing it for weight loss. Because
I don't
somehow-
understand that part. Models smoking. I don't understand it.
Yeah, because it will affect the taste buds in the tongue, so they don't feel the
eat
taste of
less.
food.
So they don't feel like
they
eating
don't
it.
feel like
I can
to
survive on
eat.
this.
Yeah, so
Yeah.
they will just take it to reduce their weights,
Wow.
and they are afraid to quit smoking because
They might gain weight.
might gain
Wow.
weight. But with the
Is that even
treatment of-
possible?
Sorry.
To gain weight after quitting smoking?
In
If
theory.
if we started medication with it, then it will be not very high.
Okay.
Yeah, and with the follow up with the doctor, it will be much easier. And we have to know that quitting smoking is like any chronic disease. It's not like that now you follow up with the doctor, and when you quit smoking, you just finish. You don't go back to your doctor.
No.
You need to keep on following
Okay,
with the doctor, at least for any long duration, to follow you up for other things, for any problems, physical or physiological problems in the body. So it's a chronic disease, like any other chronic disease, like obesity is a chronic disease, diabetes is a chronic disease. It's the same thing.
Same thing.
Yes.
Well, this is a lovely conversation. I want to segue into your aesthetic work, but right after this break.
So we're back again with our guest, and before we go on a break, Ahmed, you wanted to ask her about
Yeah, well, let's get into the aesthetic medicine.
aesthetic.
I understand family consultants and why you became a doctor initially, why you're helping smokers. Now this is more about beauty and beauty standards and how a person looks.
Botox.
And
And
Botox and
fillers.
fillers. So
And my favorite
why did you
things.
pivot to that?
Okay. Many of my patients, the quit smoking patient, they are females. And you know that smoking can affect the hair, the skin,
Right.
and the beauty. Okay.
True.
So
Does it affect women more than men?
both. Actually, both, but because
But
the
because
men
the
they
men
don't
don't
consider,
care.
they don't,
Yeah,
they don't
care.
take
Yeah,
care of
yeah,
it.
yeah.
So because they can lose hair,
True.
and it is
Have some skin issues maybe.
yes, and
Yeah.
the teeth, the color of the,
The
mouth.
teeth is the biggest problem. I would
Yeah,
say. Teeth
yeah,
is the
but
biggest
not
problem.
not only the teeth itself, even the gum and the,
gums,
color of the
yeah,
lips,
the color.
The color of the skin itself, it will be
Yeah.
affected. So now even males now they are looking for not to be like looking old. So all the wrinkles will appear. The females they have more issues regarding their beauty. So I thought maybe I can also give my patients the whole service. Like when you come to quit smoking,
All in one.
all in one. I can give you advices because usually they ask us, you know, being a doctor, they will ask you questions related to anything. And because aesthetic medicine, we don't study it also in medical school, and there is nothing being given about this, so
Right.
you will be stuck. They will ask you a question that you don't know.
True.
So I feel like a family doctor who should know many issues in
Because you're
medical.
facing everyone and their questions.
Yeah, so I have to have answers to my patient, at least to answer the questions.
Did you seek
So I
out a
decided-
diploma in aesthetic
yes,
medicine?
yes, I had
Certifications?
workshops, and then I
Workshops.
had diploma in aesthetic medicine from the Canadian diploma from
Okay,
Aesthetic Medicine
nice.
Academy.
So, I mean, you dived into a lot of fields. What is your favorite so far?
I cannot say one because my patient will
One
direct me.
complements
The most
the
you're-
other, yeah.
Mostly passionate about.
I would say it's still the family consultant. I'd
Yeah,
say,
yeah, because
Yes,
family
something.
medicine
It's the
took me
original.
to all of this. Because being a family medicine doctor, you know, you will take care of the patient as a whole. You will take care of them like physical, social, and psychological. So there is nothing that we say that the patient is separated. I cannot isolate the patient from his diseases. All diseases, which is physical, can affect his social life, can affect them psychologically. So family medicine is this concept, all the triple diagnosis, all these things together. So taking the patient as a whole in this specialty. Family medicine is like treating the children, the adolescent, the adults, and the geriatric.
Right.
So at any age, you can see that you are giving input to them. You are helping them in many issues. So family medicine, of course, it's the thing that you can. From it, you can go and treat patient with like smoking and other like aesthetic medicine. But it is the cornerstone that I feel very comfortable when I work in it.
Okay. Beauty is in the eye of the beholder. With your aesthetic work, you mostly try to treat actual problems.
Yes.
Not someone coming in, I want to look more handsome. Right?
Or beautiful. Or beautiful.
Or beautiful.
Yeah, but it is like we say, I cannot make you more beautiful, but I
Right.
can like
Enhance.
enhance.
Yeah. But there are
And
people who don't need anything and they come for really I know
measure extremes
extreme
or
surgeries. You don't go
ex-
surgical.
No, it's
aesthetic
non-surgical
stuff.
aesthetic.
extreme measures.
But people go for
It's the other way
those
around.
extreme measures. What do you think? What's your take on that? Why is it a common thing in Kuwait specifically that most females feel like I need to go to this doctor? And if you go to a certain doctor,
And there's a trend. There's always a
all
trend
the
going on.
patients look the same.
Yeah.
Same cheeks, same smile.
Texas.
Because of that doctor who knows one look, and everyone goes to him. So, what is your take on that?
The problem behind this is that the image. Many of the females, especially, they have a problem in their image. They want to see themselves, as you said, that the social media makes them feeling that they are not beautiful, and they
And
want
most
to
of
be
those people on social media are like photoshopping their photos.
exactly, but they don't understand this. They feel like every time they look in the mirror, they feel like that they have a disturbance in their image. So it's
Self-confidence.
confidence 1st. So their confidence is a problem. Then comes, as I said, because of the one factor is the social media and the society by itself. If a female she want to get married or something like that, the males, they would look in a certain beauty.
It's also
things.
male's issue.
Yeah, it's a
because
male
they
issue.
want certain things that don't even
Are you
exist.
part of the they want?
No, I'm not. And everyone knows that.
But the confidence is very important. I advise every female, be yourself.
Yeah.
Don't think about another person, because male or female who is giving
thing
you
is-
a point, it's not that you
true.
should believe them.
Thing is, you're a woman. We're in the female community here in Kuwait. You would get women approaching you like, you know what? I think you should work on your nose. I've
That is another problem.
or
yeah.
maybe have you tried lip filler? You would look amazing with that.
Or a
there's
female
always
to
some
a
comments.
female, not a doctor.
Yeah.
Yeah,
female
yeah.
to female.
There's
That's
always
the
a
issue.
comment
That's
from
the-
another female.
I feel like that's where the start of the problem
And
is.
the thing is, she actually,
Listens
she
to her.
no, it gets to you.
Yeah.
I've been told by a lot of girls, maybe you should get your lips, done, or maybe you should get your cheekbones, whatever, or Botox. How about your eyes? And it just makes me think, would I look better that way? And the thing is, when we do it, we don't do it to impress men. We do it to impress other women.
That
and
is even
that's-
weirder.
No,
The
because-
problem is that not only for aesthetic medicine, people, they are acting as doctors in many fields. It's not only the
You reach for
aesthetic
your
medicine.
information online and you think you're a professional.
Yeah, they in the WhatsApp you can receive many advices, different advices, and they would talk to you in different advices that they don't know actually this would be helpful or not.
Yeah.
And sometimes you hear very ridiculous information that is in it's not appropriate,
Like, go
incorrect.
have a bath in milk or something,
Exactly.
Milk bath.
So,
Yeah, that's a thing. Isn't that a
because
thing?
Nefertiti, she was doing
Yeah.
this.
Yeah, but that's a part of a ritual in Egypt, when
Yeah.
baby's born,
It's
baby
just,
shower thing.
Yeah, but it's not only for aesthetic medicine. They tend to be like doctors in everything. They tend to be like specialists in everything.
Right, right.
So, and one part is the aesthetic medicine or the beauty. So they tend to comment or give them advices where one advice is not suiting the other. So when you come to the doctor, he would know what is suitable for you. When you come to me, maybe I tell you, no, you don't need this. You are born with this face and your face is nice like this. Maybe if you just do something like maintain your beauty. This is what I prefer.
Like Dermapen and
Like delay the
wrinkles and the
aging,
age, sign of
that's it.
aging.
Each woman is beautiful, but just believe on that. But Allah subhanahu wa ta'ala, he created us
It's
in a
perfect
very
image, yeah.
Thing is, even men nowadays are
Yeah, that's
doing
the thing.
plastic
I had a
surgeries
friend-
and
I
flip
had
fillers
a
and Botox.
friend, a good friend of mine, he was like 25, 26 when he was at that age. He was like, I have fillers. It's like here in his cheekbones. It's like because of the wrinkles. My mom told me to get it. I was like, your mom told you to get fillers?
I can accept that the man would do Botox because sometimes some men, they have very deep.
Yeah, but is it
If it's
necessary?
extreme, then I would understand.
Sometimes I
If
can
it's
accept
extreme.
if they do some injections just to maintain like skin problems. A man who did like bariatric surgery or obesity surgery,
yeah.
and they lose too much weight, and
They have
the
they are
scars
getting
and-
married
Yeah,
or something
yeah,
like
yeah,
that.
yeah.
I can
There are are
understand this.
scenarios where it's
It's acceptable.
yeah.
But to just be like, I want to get like some men, I've seen some men getting their nose done.
Yeah.
And
how big the nose
fillers.
was.
No, I think it
I
doesn't
don't know.
matter.
People like to play with their facial features and bodies.
Or what we say in Arabic, خلقت Allah subhanahu wa ta'ala.
Yeah, we should not change this. I usually I tell them don't change anything. Allah subhanahu wa ta'ala, they created
Enhance,
Allah subhanahu wa ta'ala,
don't
they create-
change.
Yeah, and even enhancement, we cannot say enhancement. I usually say let's delay the aging process. This is the most important. We cannot enhance something Allah subhanahu wa ta'ala created.
At
It's
what
the best.
age do you think it's suitable for any person to start, putting fillers and Botox in their faces?
If we talk about aesthetic, non-surgical things, it starts from actually
Teenage.
Teenage.
years,
We
Okay.
cannot inject, but you can put creams. You can take care
No,
of
I'm talking
your
about
skin.
injections.
I guess you
Injections.
need to be an adult.
Sorry.
18.
Like from 20s, you can
20s.
start with the
stuff.
rejuvenation injection, just to lubricate.
I have seen teenagers doing lip fillers.
I know, which is it's
15
very
years
sad,
old.
Very
Very
sad.
sad.
I feel very sad when I see like this patient, and I feel why the doctor accepted this.
No, it's
Actually,
because-
when they do this, they should have their
The parents and
with
the
them.
parents is there and she approves.
She approved, but I don't know. I feel sorry for them. Usually, I don't accept it. I advise them just keep it. You are growing up. Maybe later you will feel sorry for that. You know that the lips is a very small area, and when you put filler and you continuously put filler in this area, it might go to a different place because it's a very small area. So you can see now they are talking about cases that the filler goes here, or here. Why is that? Because they continuously putting the filler again and again. And it's a small area with the lymphatic drainage. You need a good lymphatic drainage for this to go, and usually it doesn't go completely. It's true that it is not permanent filler. It's only the hyaluronic acid, but at the same time, they found that even after 10 years, you can find remains from the filler. So don't think that when you put the filler and then again and again and again, it will be. No. And sometimes they put it like less than 1 year. They want to refill it because she don't accept her face without having the lips in a specific shape. This is really dangerous.
So how often should you do it?
The recommendation don't do.
Don't.
I'm with don't, but
Don't.
but if you are like going
Like
for
under
that,
the eyes or on the face?
like let's say for example the lips. Don't jump from like you don't have any lips. We
To
have
duck
grades.
lips.
We have grades from the lips. So it's professionally we cannot jump from stage 1 to stage 6. We have stages.
Yeah.
When you go like this way, like from one like
end
to
the
4,
other end, yeah.
everybody will say to you, what you have done. It's not nice.
Obvious.
It's very obvious. You have to be step by step, and don't inject filler in the lips less than if you inject at least wait for a year to inject
Minimum and
again. Minimum.
Can I ask you a technical question? What exactly is in these fillers? What are these?
It's hyaluronic
substances?
acid. It's hyaluronic acid, which is actual. It's the collagen. It's the small particle of the collagen, which makes our skin hydrated and looking like fresh. And
Now, are there any side effects to using all that stuff?
there is no side effect from the HA, the hyaluronic acid by itself, but there is side effects from injecting in specific areas. Like for example, some would say, "Let me do for you the nose by filler," which is a very dangerous area. I don't recommend doing filler if you want to do your nose. Either I don't recommend doing noses.
Don't do anything.
Okay,
Fair,
it was very nice having you.
Yeah,
I mean,
you're so informative.
I have so many questions.
And I love your excitement.
Because I love my work. I cannot imagine myself
I
being
can
other than
tell.
a
You're
doctor.
very passionate,
Yeah.
and you're someone who's very dedicated to their line of work.
So thank you for being with us. It's quite amazing having you. You are a very informative person. I love how you do your research and you worry about the patient's health more than, the profit gain.
Yeah.
So
Yeah.
again, thank you for being with us. And,
You're a true doctor. I was what
yeah.
I would call.
Truly.
Thank you so much.
Okay.
It was my pleasure to be with you today.
Yeah, and
Thank
we'll
you.
be back
Pleasure
for
was
the...
ours. Yes, we'll be back for the wrap-up. Wow, Dr. Anwar is an amazing character. I love her excitement.
I got carried away with the Botox thing and the fillers. I just wanted to get to know, like, before I
What
do
you
anything
should
to my
do and
face.
shouldn't do.
What I should do.
Here's a pro tip. Don't do anything. Okay, we're all perfect.
I mean, yeah, perfection is overrated.
Overrated.
Nobody's perfect.
Nobody's perfect.
Yeah.
No, I'm just kidding.
Come on.
I'm kidding.
Anyway.
Yes.
So-
Thank you for tuning in. Join us next time for another guest.
And
Same
good
time,
night.
same place.